Hello guys, welcome to Deepak Pareek Clips. Thank you for clicking on this video. This is one particular clip from the main episode, the link to which is in the description. Please click on it to watch the full video. And meanwhile you're here, enjoy this clip.
We now have a Swiss segment. It's a health and wellness segment. Thanks to Swiss who's been able to help us do that. So we have a Swiss segment where it's divided into two parts. One is a myth and fact segment. I'll throw you 5 statements. You can tell me whether it's an absolute myth or there is some factual sense to it. The second is a quick rapid fire. It's not like a coffee with current, but then rapid fire, the chill hour version. So, are you ready?
Yes.
Awesome.
Let's
Myth or fact? Birth control pills can fix PCOS.
myth. So birth control pills can be a temporary, like a band-aid for treating your PCOS symptoms. That being said, yes, for women who are actually having very irregular periods and in spite of weight loss or lifestyle changes, they just don't have regular periods, birth control pills can be actually a great option. So even in women who are dealing with acne and hair growth, birth control pills are really a savior because they decrease your testosterone levels. And for women who are not getting regular periods, they help them get periods every month so that the lining of the uterus does not collect inside, because that in future can lead to increased chance of endometrial cancer or uterine cancer. So again, this is very common in PCOS women. So yes, birth control pills are not the only treatment that can fix PCOS for good, but again, they are not a bad option either. If taken correctly under guidance, they can really be helpful. We have seen so many women who are actually glad to go on, birth control pills because it makes them feel better.
Got it.
Also many people feel that, if I take birth control pills, it is going to impact my fertility. What if, I want to get pregnant in the future and this is going to harm my ovaries? So birth control pills as such will not harm your ovaries. But sometimes what it does is that it can mask your ovarian reserve. Meaning if somebody is dealing with a less egg count, is on the birth control pill, will never actually realize that they have a less egg count because they are getting their periods every month. So life goes on normally.
Correct.
So best advice would be if you have been on the birth control pill for a year or more, you can go off it. Make sure you do all your tests to evaluate that you're fit to continue taking it. Check what your ovarian reserve looks like after going off it for 3 to 4 months and then go back on it.
Got it.
That way you understand where you're standing.
So, again, it's both ways and should be done under the guidance of a gynecologist.
Correct.
Awesome. That should be like the disclaimer for the episode.
Has to be.
Second one, omega-3 supplements can help reduce period pain.
Yes. Because omega-3 supplements have anti-inflammatory properties. And there is enough evidence to show that they help in menstrual cycle, in your hormone balance, even a lot in your fertility. So I call omega-3 as the wonder nutrient.
Wonder nutrient, omega-3.
Yes.
Get it from Swiss. Vitamin D deficiency is linked with irregular cycles in PCOS.
Very much.
Yeah?
It's a fact.
Isn't vitamin D deficiency a normal occurrence, especially in India?
Most of us are deficient in vitamin D3 levels. And especially in PCOS women, we see this very commonly. So vitamin D3 for PCOS women, yes. Even for women who don't have PCOS, for their normal menstrual health, for their fertility health, very, very important. And it's always important to take the correct course of it and also then to take the maintenance dose of it. Because then again, we are not really exposed to sun. I mean, we don't really go out and sit in the sun. So the levels come back crashing down. So it's very important to keep taking maintenance doses.
So also with the right level of nutrients and lifestyle, I'm sure you can't get all the necessary nutrients and vitamins. So definitely go out in the sun, sit as much as you can, but also take the right dosage of supplements.
Yes,
to
it
get
should
that
be
done.
a combination of both things.
Combination of both. Awesome. Eating chocolates during periods actually helps reduce cramps.
Somewhere in between, I guess. It's not really a myth also. But yeah, I mean, dark chocolate, yes.
Above 70.
Yes.
Caffeine makes PMS and period pain worse. Is that true?
It does. Because, see, caffeine, again, for coffee lovers, they don't really want to go off caffeine. But caffeine can cause inflammation. Especially, it can increase your period pain or, even increase your symptoms of PMS. So what we recommend is usually not more than 150 milligrams of caffeine per day. That amounts to somewhere around 2 small cups or like 1 big cup that you can have with your breakfast in the morning. I think that should be
a larger cup.
Yeah, like once a day, that's all is okay. Yeah. How many cups do you have?
Let's not go there. 2 cups. I think 2 cups of this. Half a mug of this should be good. But I don't consume coffee as such. I'm a chai lover that way. So I usually consume. Exactly. But then I have sugar free. I don't sugar less, not sugar free, sugar less. Awesome. We now move on to a very quick rapid fire segment.
Okay, I hope you have a hamper for me.
We definitely have a hamper for you. It's a lot of love and a lot of adulation for you. One period myth you would want to bust forever.
Don't ignore if you're having painful periods.
One supplement you wish every woman with PCOS would include in her diet. What would that supplement be?
Has to be omega-3 and magnesium. And actually even inositols. Like inositols work as great insulin sensitizers for women with PCOS. So I think all 3.
All 3?
Yeah.
One habit women should drop immediately for better hormonal health.
Stay away from environmental toxins. I mean, try to rather. So be mindful in what you are, drinking water from, eating from, your cosmetics, because they can actually play a very big role.
That helps. One supplement that can help reduce period pain.
Yes, off-the-counter drugs are many, but I think magnesium along with vitamin B6 again is very great for PMS or period pain. You can actually try that.
Got it. One vitamin deficiency most women don't realize they have.
Vitamin D. I mean, it's always there.
All right. And the last one is one supplement that actually helps improve sleep during PMS.
Melatonin.
Yes.
So, again, how much melatonin you are taking, that's important. So, anywhere between 3 to 5 mg is a good enough dose. That should be enough. Even magnesium rather helps you with better sleep. So, whatever suits you better.
Awesome. Again, under the guidance of a doctor.
Yes.
Awesome. We'll keep that as a disclaimer point when we move forward. Since we are at supplements and hormonal health, and we have spoken about hormonal supplements initially in our earlier conversation as well, I also wanted to sort of discuss that since it's established that supplements are a great way to manage hormonal health along with the right diet and lifestyle, I really wanted to understand, are supplements like iron, vitamin D, omega-3 really effective for managing period pain or women with PCOS?
So iron, yes. Actually, iron deficiency anemia is the most common cause of anemia that we see. Almost 1.2 billion people suffer from iron deficiency anemia.
1.2 billion?
Billion, yeah. And whenever we get our monthly periods, almost 10 to 40 mg of iron is lost whenever you're bleeding. So iron, yes, is very important. And when you take it along with vitamin C, the absorption is much better. So a combination of iron, vitamin C and certain amino acids, this combination is great to keep your iron levels under check.
But how can they know if they're anemic?
So usually if you're a woman and your hemoglobin, which is usually reflected in a CBC report, if that is less than 12, then yes, you need to be treated for anemia. There are some women who have chronic anemia. They need further evaluation to understand why their hemoglobin just doesn't increase. Their hemoglobin sometimes just doesn't go up beyond 7 or 8. But that is not something that is to be ignored. You actually need further evaluation and what best form of absorption can be given to you for iron, like whether oral or sometimes even IV drips can work for you.
Got it. Is magnesium really a game changer?
Yes, I think magnesium, yes. For both women with PCOS and with PMS. Again, in PMS, if you combine magnesium and vitamin B6, it works really well. In PCOS, again, it works by regulating your sleep cycle and as an anti-inflammatory and even decreasing your insulin levels. Here also a combination of magnesium with some vitamin D, zinc, calcium is a great combination.
We also spoke about omega-3
Yes.
fatty acids, which is fish oil and flaxseed oil. That also helps reduce inflammation.
Absolutely. Absolutely. In fact, there are studies to show that it helps with correcting your hormones. It helps in making your egg quality better, even for sperm health and even for embryo implantation. So somebody who's also trying to get pregnant, omega-3 is a great kind of supplement to have.
But again, what about the dosage? Should be
Usually
consulted
anywhere between 600 to 1000 mg is a great dose to take once a day. That should be enough.
once a day. And how about vitamin D? You mentioned about vitamin D
Yes.
taking with some other supplement or vitamin D in.
So vitamin D in itself is okay, or you can even combine it with calcium. Again, vitamin D plays a very huge role in women's health. There are receptors of vitamin D which are found on the surface of the eggs. So that's how vitamin D deficiency can lead to irregular periods or menstrual cycle imbalance. Again, vitamin D in PCOS women, very important, helps decrease your insulin levels, helps decrease the inflammation. And vitamin D is also helpful in making your eggs grow properly. So if you're somebody who's trying for a pregnancy, if there is decreased vitamin D3 levels, your calcium levels are going to get dysregulated, and this can lead to arrest of eggs in the follicular phase. So lot of roles vitamin D has to play in your body. So make sure you're
So
taking
D
your
taken
D3
with
levels.
calcium is better in that case?
Ideally, yes. Yes.
D taken with calcium.
Yes.
And iron taken with omega-3.
Vitamin C and amino acids. But yeah, iron and vitamin C is also a great combination.
Hello guys, thank you so much for watching the video. If you liked it, please like, share, subscribe, share it around on your WhatsApp, on your Instagram, Tinder, Bumble, every single where, because we need that traction. But thank you so much for watching the video, and you will come across every new clip every single day. So don't forget to subscribe, and I'll see you guys around. Thank you. Cheers.